the Brain Health Clinic blueprint started, as many things do, with a conversation. So there was a group of people, professionals working with those who have dementia at a dementia masterclass by Neurology Academy. And they were talking about the need to prioritise brain health among individuals in the general population, but particularly people who are presenting with cognitive decline or mild cognitive impairment. We know that up to 30% of cases of dementia occur because of lifestyle-related risks. So that means if those lifestyle practices can be altered, then that risk of developing dementia decreases. That's things like vascular risks, obesity, diabetes, high blood pressure, alcohol misuse, but it's also more about how we live. So how active we are. If you're inactive, if you feel lonely, if you develop depression in later life and don't get that treated, these all have an impact, as well as do things like hearing impairment. And despite knowing this, often people will be seen with cognitive decline, told that they have mild cognitive impairment, and then just sort of left and monitored. But it's sort of a waiting game to see if they develop dementia. And of course, having MCI does not mean that you will develop dementia. It just means you have an increased risk of doing so. So from these conversations and lots of ideas about what could be done, I had the privilege of becoming involved and turning all these ideas into, I guess, like a service framework. And that was the Brain Health Clinic blueprint. And it sets out sort of 4 stages of care for people who are presenting with mild cognitive impairment, which they're not really very rigid. They can be applied to any service model. And it gives really clear evidence-based framework for how to move forward with someone who has MCI. So it begins with identification, which would generally take place at primary care with GPs, and talks about the importance of a good clinical assessment, removing any potential reversible causes of cognitive decline. And then if that person does seem to have mild cognitive impairment, they would then move on to stage 2 of the blueprint, which is the full assessment. And ideally that would take place within a memory assessment service, brain health clinic, maybe somewhere in secondary care. And the blueprint sets out really clear assessment guidance. So across loads of different domains, cognitive, behavioural, etc. And it gives a list of lots of assessment tools that would be appropriate to use in those circumstances. The blueprint then, if that person is definitely found to have mild cognitive impairment, gives a sort of a patient flow, and it segments people into whether they might be higher risk of developing dementia, lower risk of developing dementia, and suggests some interventions that might be appropriate. And those interventions are around risk factor modification, comorbidity management, non-pharmacologic cognitive-based interventions, and then disease-modifying therapies, which, as we know, aren't here yet, but following the Edinburgh Consensus model of sort of getting ready for those, it includes those as well. And then the final stage of the blueprint looks at ongoing care across a range of categories, including education and health and legal support, activities of daily living. And some of those things will be appropriate for that person who has mild cognitive impairment, and some of them might not be appropriate at all, but they're there for the practitioners to kind of consider and be aware of and think about in that person's ongoing care. So it's sort of a low level amount of support from the very beginning, as opposed to no support and then lots of support needed later on should they develop dementia. And then right at the end of the blueprint, as well as all of the references supporting all of the ideas and the interventions and all that kind of thing, there's also some resources to help people to adapt the blueprint to whatever their current service model is.